Scooping and resheathing needle in your IM and subcutaneous injection skill. These minor changes that happen in your NMC OSCE can worry you. Let's look at in this video how do we avoid these errors. We have a channel called HSD Learning. Please do not forget to subscribe to our channel. If you like any videos, let us know what you want to see next. Let's see in this video how do I avoid these common errors. IM injection, scooping and resheathing, how can we avoid it? Let's look at closely. I'm going to show you all those steps. I'm going to mainly focus on common errors which you can avoid. So I'm going to start with the preparation. I'm going to show you how to inject and how to remove the needle using the sharp bin or not using the sharp bin. So let's look at which is the right method to use without doing scooping and resheathing. Now look at the equipment that we have here. So you have the medication that can be given in a plastic bottle or in a vial. You need to consider this as a glass. You have the normal syringe which can be 2 ml or a 5 ml syringe, 2 ml ideally preferred. You have a normal needle which is an injecting needle, or you have a safety cap needle which is also an injecting needle. Now this red color needle can be red or pink color. This is a blunt needle for preparation. So this is for preparation, this is for injecting. One of them you got to use, and this is the syringe. So you need the plaster. You need the wipes, you need the cotton, gloves, apron, and you need the sharp bin. Now, before preparing the medication, you will be going to the patient and doing the identity check, gaining consent. Once you have done that, you come for preparation. When you're coming for preparation, first thing you do is the alcohol gel or hand hygiene. You do the 7 steps of hand hygiene. Wear the apron. Common error people forget here is wearing apron and gloves for preparation. So it's a community scenario. Why do we need to wear the apron and gloves? Now in UK, even if it's a community, we carry our apron and gloves and we wear the apron and gloves for medication preparation or any other procedures. So you're going to wear the gloves. Now first thing you do here is the medication cleaning. You clean the medication using the chlorhexidine wipe. You clean it for 30 seconds, allow it to dry for 30 seconds. Now you can leave that in the tray. If it is a vial, you clean the top and clean the sides. They can give you vial or a bottle for IM injection, but the process is same. So you can leave the dirty wipe on the table on the side or discard into the clinical waste bin. Now first thing I'm going to do is the syringe. Now, error to avoid here, how to open the syringe. People I seen that opening the syringe by breaking open. By doing that, you can contaminate the tip. Please avoid that. Right way of doing the opening the syringe is peeling. So you peel the syringe, hold it, do not drop it into the tray. That can contaminate the tip. Now you use the blunt needle, again blunt needle, you peel it open to avoid the contamination of the base of the needle. So connect it. Now if you want to, when you're connecting, one tip I'm going to give you, don't twist it too hard. If you twist it too hard, you might find it difficult to release it later, which I'm going to show you. So now once you connected it, now I can place the syringe where the key part is protected into the tray. Now you can withdraw the medication you can take the cap off the bottle and discard that into the sharp bin because the glass. And then now you prepare the medication. Take the cap off the blunt needle, keep that in the tray. Now you draw the medication carefully. When you draw the medication, usually more than 1 ml. If it is 1 ml is required as per prescription. So if you look at carefully here, so any excess you can put it in the tray. So I have still kept it little more than 1 ml. Now scooping is not allowed. Now how do I remove the needle without doing the scooping technique? Scooping is nothing but putting the cap back, not allowed. So I am going to remove the needle using the gloved finger at the base of the needle. Only hold the plastic bit, twist it without touching the syringe, and discard that into the sharp bin. Now you put the injecting needle. I'm going to use the safety cap needle. Connect it. And do not worry about this cap. So now you can place that into the tray. Once you prepare the medication, you place the other things into the tray. You might need the plaster. Check all your equipment that is ready. So you take your gloves off. Alcohol gel your hand. While you're alcohol gelling, you can do the second ID check. So you can ask for patient details and date of birth, whatever is required for the ID check. Do not forget the allergy as well. So you're going to wear the gloves. So once you wear the gloves, alright, so you're going to take the wipe. Now here common error is people forgetting the acromion process, identifying where to give the medication. You usually give it to the deltoid muscle if it is the shoulder. So you identify the acromion process. From acromion process 2.5 to 5 centimeter below. So I am going to clean the skin. Best method of cleaning the skin with chlorhexidine wipe is up and down and side to side. No single wipe and no circular motion. That's the error you can avoid. So up and down, scrub it for 30 seconds. Allow it to dry for 30 seconds. So discard that into the clinical waste bin. Now remove the cap of the injecting needle. You're going to stretch the skin. Inject 90 degree, leave the 1 centimeter of needle out and inject the medication over 10 seconds, 2, 3, 4, 5, 6, 7, 8, 9, 10. Allow for 10 seconds for the medication to absorb. Take the needle out, and now once you take the needle out, very important to take care of the sharp straight away. So what do you do? Common error people do here is recapping the safety cap with the finger. Not acceptable. So best way to do is use the sharp bin, lock the needle, and you can discard whole syringe and needle if you want, or you can take the cap off with the finger. But best method after injecting maybe use the sharp bin to take the needle out. So needle has fallen. This can be thrown into the clinical waste bin. So now you offer the cotton, apply gentle pressure, and then you can apply the plaster or offer the plaster. So once that is done, take your gloves off, take your apron off. Alcohol gel your hand. and complete your signature and date and time. Please put the exam date or date of your assessment, and then you can reassure the patient, stay with the patient 30 minutes, whatever has to be said, and then alcohol gel your hand and then leave. Hope this video has helped you to avoid the common errors, not to do scooping and resheathing, how to remove the blunt needle, and also how to remove the injecting needle after injecting without touching it. And let us know what you like to see next. Thank you for watching us.